get that tissue closed. So, and that's being picky. Closing the wound. I was telling you about Army soldiers, so Army guys. This is what they're using now. It's full of those collagen plugs that are resorbable. They put that into a big open wound, inject that stuff in there as it goes back, and it absorbs that blood, and it stops it, it clots it, and the body will grow tissues back through it. They're saving their lives with that. And that's the same stuff that's in these. Okay, these, I pulled both of these pictures off of Amazon. The one with the purple tag there, it has that silver colloid on it. Okay, this is one of the things that spend your $5 or spend your $11 for the one if you want the silver on it. And like I said, hope you never need it. But that alone, that piece alone with some duct tape could save somebody's life. If that's all you had, and they had a big wound that was bleeding, that and a piece of duct tape will save their life. And if you buy the ones that say resorbable, some of them are not resorbable, but if you buy the ones that say resorbable collagen, they can be used internally too, like the stuff in this tube. Okay? If it's not resorbable, then you don't want to put it inside. But if you had somebody that had an artery that's bleeding and you have resorbable, you can put it against that, close it up, and save their life too. Okay. Hey, where'd that go, Stan? Okay. So I know we're out of time. I brought some sutures here, some oranges for anybody that wants to do a suture. Once you put that suture in, and that was, if I can get to that last slide, well, it just talked about covering it. Okay? That's where you can use one of those gel packs. If it's not bleeding, you can just do your gauze over it and bind it up. You don't want it tight because you don't want to slow down blood flow. But once you've sutured it, you want to keep that area clean for at least a couple of days so that we get that primary closure without any bacteria in it. Okay? And so that wound dressing helps just to keep it in the environment. I mean, I do it in the mouth all the time, and we just leave that open in the environment, and it's a terrible, dirty place with all kinds of bacteria that you could ever imagine on that. And unless somebody had a bad infection, I don't even give them an antibiotic to continue. The body will clean it up. But on the outside, some of those bugs are meaner than what's in your mouth. And that's why I'd say you want to make sure that that's clean and covered so that it can heal, give it a chance to heal. So I hope I didn't bore you too bad today. Hope you got some good information. Anybody that wants to, I know that we're past the 1 hour mark. Anybody that wants to stay, we'll take a minute and stitch up an orange. Okay? Because like I said, stitching an orange, putting a suture through an orange, is basically the same consistency putting it through skin.
And then we can give it a shot.
Yeah. No, I was going to eat these when you're done. You can't give it a shot.
Okay.
Thank you, Todd. And the PowerPoint of this will be online. You go to our website.
It's already there.
Okay, and we're going to add so that we can, anybody that wants that first aid list to do themselves,
Check off
they
list.
can, check off list, then they can just pull that and print it off of the web.
But that's not there yet.
Yeah, because
But
that's
we'll
something we
have
just discussed right
Another
before
day
the
or two.
meeting.
If we want you to do your magic with putting stuff together, can we give you a name or with getting supplies if you want to try to?
Let's put Stan in charge of that.
Susan, would you take care of that?
Not just Susan.
Susan's the scribe, so she gets it. Yeah, and so whoever wants it, let Susan know if you want one. And that doesn't mean you have to have one, because I'll go through and tell you what my costs are going to be.
Me too.
Okay? And you can decide whether or not that's ridiculous, or because I think half of my supplies costs are ridiculous anyway. So yeah. So if you want, if you have interest, write your name down. Doesn't mean that you need one. You don't have to buy one from it. That's just so that I would know how many I want to build if I'm going to build them. And those that I build, any pieces, I'll package them as individual stuff, and I'll run it through my sterilizer. So it's all sterile, not just clean, but sterile when you get it. So you'll have a sterile care.
You know her.
So.
All right. Very good.
You guys, we're making a list right here, if you want your name on the list.
Yeah.
My name's already on a lot of lists, I don't want to.
Say if you want to sit in one of these chairs. Okay, so take your orange and just cut yourself a nice line. So, you want to do one of these?
Yeah.
Pull up and sit there. Okay, yeah, and we should be able to use these on several of them. Yeah, you want to?
You'll be a breeze of this. I can take them out. You get sent out.
When I was in respiratory school, we had one to do like very infectious.
Pull that again. We're not worried about these things. Now, when you pull that, it's going to pop up that little piece of paper here. And the paper, you just pull the corner back a little bit.
What is this about?
And so, I asked
First thing with that,
You would use that needle to puncture those things in your mouth, right?
yes, yeah. Okay, so, you know,
Already has the stuff attached to it.
yeah, this already has the
You don't have
chromic,
to thread the
this
needle.
is chromic gut, yeah, it's already attached to it. And it's nice that way because then it doesn't pull through the tissue as it goes.
Are you gonna do a dual cut, so you got stitches under layer and top layer?
What are we going to do?
In case your cut gets that big.
You know, if pull the tooth on top of the ground, you're just gonna die. Okay, yeah, you're just gonna die. Yeah.
If you get it too deep,
Question. You gotta do two layers, yeah, that's what I
then you gotta stitch on top.
Okay, that's an excellent point, because if I have this big, and let's even make this worse, okay? So I'm gonna peel that back a little bit, tear that skin a little bit. Okay, so I got this big flat flap of skin here. I'm gonna push it down first, before it's there, and then I'm just gonna slide it over until it touches, okay? So that's a good question, because once in a while, you will have a big old torn piece of skin like that. But if you lay it down flat back onto the side first, then just put light pressure against it, you'll bring it up. That's usually an easy part. The part that people get is that get it to where it's squozen up there too tight, like that bottom picture over there, is when you pull tight on those stitches.
So,
Okay?
how do you like hold it and then with the suture, with one hand you do the suture while you're holding it together?
Okay, yeah. So I'll do one. Where's my best place to do that so everybody can see? So I'm going to appropriate that tissue with my thumb. And if you have somebody else that's...
Why doesn't everybody come around and
No.
look over our shoulders? Everybody so that you can...
Well, let Todd come around here and then everybody's out there.
For this piece, yeah, just for this one, I'll sit right there and then I'll come back. So if you have somebody that's, you guys will be able to see.
No, you can't get the other
That's because I'm not on a diet.
No, that's because this isn't tight.
Okay.
That's her seat, finding his own.
Okay.
I'm telling you.
So if you have somebody else that's an assistant and they trust you,
I know.
they can just put their finger against it.